All right, so this one is drugs for muscle spasm and spasticity, which is if you have usually an underlying disease. One example is multiple sclerosis. So we'll get started on the slideshow here. All right, so it's hard when you have spasticity because you cannot focus. People with Tourette's also have spasticity in their joints and limbs and etc. So it's difficult to focus. So what that is an involuntary contraction of muscle or muscle group. You just can't help it. So years ago, we used to use whirlpool bath at the physical therapy. So here's just a picture of from years ago. But that is still used today. There's a lot of non-medication modalities that are used, including like foot massagers or massagers to get your legs, the circulation better. Hopefully that'll help with the muscles. Those are all more what we call anecdotal, where they're not completely evidence-based, or if it is, it's not always a cure-all for it. So we're going to talk about some drug therapy and some anti-inflammatory aspirin. There's some centrally acting muscle relaxants called diazepam and tizanidine. Diazepam, as you probably know, is VALIUM, and this relieves localized spasm caused by specific muscle injury. So if somebody comes in with acute back pain, you can try some VALIUM or tizanidine and see if that will help relax the muscles in the area, and so they can move their back and help with healing. But it can cause you to be tired. Not everybody feels that way when they take it, but low doses are always the best. You have to watch for central nervous system depression. If they're taking it long term, then you have to watch their liver because that can cause damage with long-term use. Again, just remember that's potential. You can also become physically dependent on it. Whoops, okay. So spasticity, movement disorders of the central nervous origin. So what we just talked about is drug therapy for like more of a muscle relaxant. So there's muscle spasms, but they're caused by injury. But let's talk more about spasticity now, which is actually coming from your central nervous system. MS, cerebral palsy is just a couple of the common causes. So you have heightened muscle tone, so you can have spasm. And if you have spasms, it's hard for you to use your hands or your limbs. There's 3 drugs for spasticity. It's baclofen, diazepam again, and dantrolene. And both the top 2 act in the CNS and the bottom works directly with smooth muscle. It's not really used that much anymore. So baclofen is used for spasticity, but we also use baclofen for acute muscle injury too, but this is particularly one of the indications is muscle spasticity from central nervous system issues. So uses MS, spinal cord injury, cerebral palsy. It's not used with stroke. Oh, and as you can see here, how the myelin sheath, this is your nerve fiber, how in multiple sclerosis it becomes scarred. It's kind of similar to Alzheimer's, but it's dealing with a different nerve synapse, that more of the acetylcholine instead of these particular nerve fibers. So there's no antidote for overdose because so you have to be careful. It also depresses your CNS. It's a member, Valium is a member of the benzodiazepine family. So we just talked about baclofen, let's talk about Valium. It also affects the CNS, and it's used for multiple things, but one of the things is for spasticity, and that can cause sedation. It can also cause addiction to the medication. And dantrolene is used for malignant hyperthermia. That's usually, they have a reaction to anesthesia. So again, I've never seen it used. Maybe in the OR I've seen it used. But if they do have that, they give them dantrolene. And this picture here are other things, because what happens is you become hyperthermic. Your body temperature goes way up, and it can be very dangerous. You can die from that. Adverse effects of that drug, though, is liver issues, muscle weakness, drowsiness, diarrhea, acne-like rash. But again, I have not seen it used before. And so it's a rare drug use. You probably won't see it. All right, take care.